lung. It is one of the most dangerous types of venous thromboembolism, which is the general term for when blood clots form in veins. Pulmonary embolism occurs when a small blood clot, or embolus, breaks off from a larger clot, or thrombus, and travels to the lung where it can cause a potentially life-threatening blockage. Symptoms include chest pain, shortness of breath, heart palpitations, coughing up blood, fainting, and, in severe cases, signs of shock and low blood pressure. These symptoms are caused by damage to the lungs, which also affects the heart, the right ventricle in particular. The right side of the heart pumps blood to the lungs and is thinner and weaker than the left. When a pulmonary embolism blocks the blood vessels of the lung, there's a sudden increase in pressure in the pulmonary artery. This increases the afterload of the right ventricle, which is the pressure the heart must work against to pump blood. As a result, in some patients, the right ventricle has to work harder to keep pumping blood. But after a certain threshold, it fails. This disrupts blood flow to vital organs, leading to death, a process known as hemodynamic collapse. Individuals at increased risk of pulmonary embolism include older people, those with pneumonia, those undergoing surgery and long hospital stays, people who have major bone fractures with trauma, and people who are immobilized for long periods. Other medical conditions can also be a risk factor, such as genetic diseases of the coagulation cascade, sickle cell disease, and chronic obstructive pulmonary disease. There are a number of treatments available for pulmonary embolism, including antithrombotic treatment with drugs, such as direct oral anticoagulants, vitamin K antagonists, and low molecular weight heparin. There are also medical procedures, such as reperfusion therapy, to restore blood flow to the blocked vessels. Despite these treatments, up to 1 in 10 patients will die of venous thromboembolism within 1 year, and at least 1 in 5 patients will have recurrence within 5 years if their venous thromboembolism developed without a clear cause, so-called idiopathic thromboembolism. Patients who survive can develop post-pulmonary embolism syndrome, a poorly understood condition characterized by exercise intolerance, shortness of breath, and a reduction in quality of life. As research continues, a better understanding of pulmonary embolism and improved treatment should lead to better chances of survival and a better quality of life for those with this condition.